Hello and welcome back to episode 5 in our pregnancy series where we're going to be talking about lower body strength training. If you're new here, welcome. My name is Christie Amundson. I'm a physical therapist and I'm also 24 weeks pregnant this week. We're going to be uploading weekly videos starting at the 20-week mark all the way through the end of my pregnancy with helpful topics and common questions for pregnant and postpartum women. So last week we talked about upper body strength training, and this is kind of part 2 where we're going to talk about lower body strength training. There are tons of benefits to exercise in general, but especially during pregnancy, which include less constipation, less swelling in your arms and legs. You're less likely to develop gestational diabetes, and you have, on average, according to research, shorter labor times. Yay! So, weight training or strength training specifically can actually increase your joint stability. And as we know, during pregnancy, our hormones cause a lot of laxity within our joints and soft tissues. So strength training specifically can help remedy that and stabilize those joints a little bit better. As always, if you are new to any kind of an exercise program, you'll want to check with your medical provider, your primary care doctor, or whoever is following your pregnancy to get the okay and clearance to move forward with any kind of exercise program before you start it. But in the same vein as the last week, episode 4, we're going to be discussing the most important muscle groups in the lower body to include in your weight training routine or strength training routine. This is not saying that this is an all-inclusive lower body strength training program. I'm just going to highlight the main muscle groups that are the most important for you if you're pregnant or in the postpartum period. So the first one is your hamstrings, which are the muscles in the backs of your thighs. They help bend your knee, but they also, when you're standing up, can help, they come up and attach to your butt bone, so they can help kind of turn that pelvis back under and kind of counteract the weight of the baby from pulling you forward and putting all the pressure on your low back. The other muscle groups we're going to talk about are both glutes. So one is your glute max, which is mostly the muscle that comes across in your butt region here. It helps kick you back. So when you're walking, it can propel you forward, and it can help you push to the opposite side. So when you're walking, your right glute helps to push you to the left, and vice versa. It also can, if you're sitting down, turn your leg out to the side, or if your foot isn't on the floor, turn your leg out to the side. The last one is your glute medius, which actually makes kind of like a fan all the way around your outer hip and butt area. So depending on which fibers we're working, that muscle can turn out, similar to your glute max. It can also kick out to the side, and it can also turn in, depending on which fibers that we're talking about. Super important to help you balance and for pelvic stability when you're walking, and just in general. So all 3 of these muscles are really important to help stabilize your pelvis during pregnancy as things get looser and more unstable. And they also help both during pregnancy and after pregnancy reduce your back pain, keep everything a little bit more kind of together and stabilized. And it can help with retraining after you are done when you're in the postpartum period, getting back to kind of a normal posture and a normal muscle activation pattern. All right, so we're going to start with hamstrings. So I'm going to show you 2 different exercises for hamstrings. So let's go. All right, so we're going to start with hamstrings. Again, that's the muscles in the backs of your thighs. I'm going to show you 2 different exercises. I'm not necessarily saying that you need to do both of these exercises, but if one seems like it's bothering you, one's a little bit more higher level than the other, so I'm going to show you a lying down version and a standing up version. So typically, if the standing up version is a little bit problematic because it's giving you pain, then I would not recommend it, and I would recommend you do the lying down version and vice versa. So I'm going to do an exercise lying on my back. If you're more than 20 weeks gestation in pregnancy, you're going to want to elevate yourself to at least a 30-degree angle. So that's why I have this wedge here. If you don't have a wedge like this at home, you can use pillows. Just make sure that you pile them up high enough that when you lie down on them, obviously they're going to squish down. You don't want the pillows coming and pushing your head forward. And you also want to make sure that by the time you're lying down on them, they don't squish to where you're lower than the 30-degree angle. So this first exercise, I'm going to lie down on my back. And I'm going to have my knees bent and my feet flat. It is a little bit better if you can wear shoes when you do this, because it gives your feet some feedback, but you don't have to. So I'm going to keep my feet and my knees about hip width apart. So I don't want to squeeze my knees in like this or let them turn out. And what I'm going to do is I'm going to gently press my heels into the floor. When I do that, I'm not doing this where I'm pulling my toes up, so I want my feet to stay flat, but just the pressure to go through my heels. And it's like I am trying to drag my feet back toward my butt. So you want your feet out far enough that you don't get hamstring cramps when you do this. So if you're getting cramps in that muscle, usually it's because your knees are too bent. So if you're out far enough, you're going to push down and then tug back like I'm trying to pull myself that way. And then I'm going to roll my pelvis under. So it's sort of like I'm trying to flatten my back, and I'm going to hold here. So I want my back and my abs to be relatively relaxed and make my legs do the work. If you've done like a pelvic tilt exercise before, a lot of times people will do pelvic tilt exercises with just their abs. In this exercise, we're trying to do it with your hamstrings. So again, push down, pull back, and then roll your tailbone up just a little bit. And once you do that, you can do a little bit of a lift or a bridge, if you're familiar with that term, where you're lifting up like this. The key to this is I don't want you to lift up really high like a normal bridge. You're lifting an inch or two off the mat, but you're lifting all with your hamstrings. So as I lift, traditionally a bridge, you would kind of lift like this, where your back would kind of arch. And with what I'm doing, I'm pushing down, pulling back, rolling under, and then lifting a little bit. So you can see how it kind of almost rolls me more when I lift, as opposed to doing this, where I'm not rolling more. So push down, pull back, roll up, lift. Now you could just hold this as you breathe. Or if you want, you could kind of pulse up and down. I don't recommend coming all the way down, going all the way back up. That can kind of torque on your back a little bit too much. So make sure you maintain the position and either just pulse up and down or just hold it. You could do, if you're pulsing, do 20 to 30 pulses and then come down. If you feel like this is too easy for you, and a more advanced way of doing this is to kick one leg out. So again, I'm going to push down, pull back, roll under, lift a little bit, and then I'm going to kick my leg straight and bend, and straight and bend. And this is going to work my left hamstring as I'm kicking my right leg. What you don't want to do when you do this is when I straighten my leg, I do not want my same side hip to drop down like that. That means your hamstring is not doing a good job of stabilizing your pelvis. So if you cannot do this exercise because either it hurts or because you cannot keep your pelvis level when you kick, then don't do that part. So that's this lying down exercise. Then I'm going to show you a standing up version. You can use a band. You can also use an ankle weight if you want. If you don't have an ankle weight or a band, if you put a really heavy shoe on, like a boot, or if you just fill a sock with pennies, you can tie it around your ankle and use it as an ankle weight. So we're going to go here. I'm going to use the band. If you put the band on, this band has a loop, which is helpful. You either want the loop here or you want to make it a big loop like this. But either way, you're going to put it around your ankle Actually, let me do this side because. And then to avoid the band rolling up your leg, I usually do kind of put it over my heel like this. Like that. And then the knot is right in the front of my foot. So I'm going to use the back of a chair or a table, and I want to put my hands down on the table or countertop or back of the chair. The purpose of this is I want you to round your back a little bit so that your back you're not going to overuse your back for this exercise. So you're going to round your back. When I round my back, I do not want my shoulders to come up like this. So they're staying down. And this band I'm either going to tie to the leg of my chair, or if you're lazy like me, you're just going to step on it. And if you're stepping on it, I recommend wrapping it around your foot at least once, just so that you don't have it snap back on you, surprisingly. So round your back. Your weight is going to be back on your heels. And then you're going to lift the leg that has the band up. Your knees are going to stay together. You're going to kick behind you. So you could just bend it up like this as far as you can, and then lower it back down like this. And you could repeat this anywhere from, I would recommend probably 15 to 30 times. So you want to choose a band that you can do at least 15 reps with. When you do this, notice my knee is staying next to the other knee. It is not going forward as I bend my knee. To make it a little harder, you can bend it up and kick it back. Sorry, the wall's in my way here, so let me move forward a little bit. So I'm going to bend it up, kick it back, come back, down. Same thing, about 15 to 30 reps. When you do this, you do not want to kick it way back because you can see how that arches my back. So you want to make sure when you're doing this exercise that you can stay in that kind of rounded and almost like you're tucking your tailbone under, or you're tucking your butt underneath you, bringing the baby up toward your face when you're doing this, and not arching as you do it. All right, and then obviously you would do both sides. So this exercise, because it is single leg, sometimes can be a little more problematic if you're having more pelvic floor pain, pubic pain, hip pain, SI pain. So if you're getting any of that, I would recommend doing the one on your back that has both legs on the ground where you're not kicking. All right, so now I'm going to show you the glute exercises. Again, there are 2 glute muscle groups that we're going to be working on. And I'm actually going to show you them both in a row because it's kind of handy. Both exercises, one for the glute max, one for the glute med, are in the same exact position. So you can kind of do them one right after another, and you will want to do both sides. So all you need for this is a pillow for your head. You're going to lie on your side, and you need some kind of a surface that isn't going to move if you push into it a little bit. So the wall works great. Otherwise, you can use like a couch or a recliner, as long as it's heavy enough that when you push into it a little bit, it's not going to just slide across the floor. So what you're going to do is lie down, usually whatever you're going to use, like for your wall. I recommend sitting literally right now next to the wall before you lie down. That way you don't have to scoot a lot. So I'm going to scoot back as far as I can. I'm right next to the wall, and I'm going to just lie down on my side. And when I lie down on my side, I'm going to bring my feet up on the wall like this. So I want to be about a 90-degree angle, and I want my feet to be flat. So if I pull my feet back like this, you can see how my feet are not flat on the wall. So I'm going to scoot back a little bit, and I want my feet flat, and I want to be at about a 90-degree angle here. If a 90-degree angle feels way too compressed, depending on where you are in your gestation, you can move a little bit away, give your belly a little more space. But ideally, you want it as close to 90 degrees as you can. So you're on your side, You're going to stack both your feet and your knees. You're going to push both feet gently into the wall. When you do that, you want to push more through your heels than the balls of your feet. But again, I don't want your feet doing this. So flat feet. I also want your back to be kind of curved like a C shape or like a rainbow. So it's sort of like you're curling around your baby like this. When you do that, it's tempting to bring your chin all the way down in your chest like this, but we don't want your chin in your chest. So your head's going to come up, even though the rest of your body is kind of making that C shape. Okay, so for the first glute, what you're going to do is very gently, as you're pushing into the wall for stability, you're going to go forward with your top knee, just a little bit, not a lot. If you're getting SI pain in the back or hip pain or pubic pain when you do this, you're going too far. So just a little bit, enough that I can see that my top knee is ahead of my bottom knee. And then I'm going to lift my knee up a little bit. When I lift it up, my foot is staying flat. I do not want my foot to do this when I lift it up. So if you're wearing shoes, you want to keep the arch of your shoe on this inside down on the shoe, not rock to the outside of the shoe. So again, you go forward, up. I'm still tucking my butt under, so this is going to be tempting for your body to arch your back and use your back muscles instead of your glute. So to avoid that, you got to round out, tuck your butt under, go forward and up, and then you're going to take this top hip and reach it toward the wall a little bit. When you do that, again, you want to keep rounded. So it sort of feels like I'm trying to make a gap under this side. So I'm using my ab a little bit on this side. This should make you feel your top butt a lot. You can hold it here for a minute or so, or you could pulse up and down like this. If that's too easy, you can also use a band, tie the band around your legs, and do repetitions with the band. But this should make you feel this glute a lot. Again, I don't recommend coming all the way down, relaxing, then going back up. I recommend holding that contraction the whole time as you move it. Again, if you're getting pubic pain or back pain or SI pain or pain down your leg, it usually indicates that you're either doing one of two things. You're either arching your back, or you are shifting a little bit too much. So I would back off on how much you're shifting and also focus on kind of rounding a little bit more. So that's the glute max exercise. The second one, the glute med exercise, is going to be in the same exact position. So I'm going to go back in that same position. And it's kind of a little bit the opposite of what we were just doing. So instead of going forward and up like we were just doing, similarly, you're going to push your feet into the wall through your heels. And this time, I'm going to round my back, shift my hip back. So now my knee should be behind, my top knee should be behind my bottom knee. And I'm going to lift my foot up just a little bit so that my foot is higher than my knee here, so it is not on the wall anymore. And now I'm going to lift my whole leg so that my knees are apart. So if I can just hold this and breathe and feel my butt, great. Or I could do repetitions where I'm going apart and together. When I do that, I want my foot to stay higher than my knee the whole time. So I don't want to be going like this all over the place. So again, shift back, round out, shift back, lift the foot, lift the knee. You're either going to hold and breathe, or you're going to do you can do pulses or repetitions. You can also add the band to make it more challenging for up down. Again, as you go up down, your knee is staying back, so it's not going forward, staying back, but literally it's just your legs are going apart together, but only to the point where you can keep your foot above your knee. So again, if you're holding it for about a minute, I would recommend doing 4 or 5 of them in a row on each side. And if you're doing repetitions or pulsing, you would go relatively slow, but it's a pretty small range of motion that you're using. So again, you're going to want to be able to do at least 15 to 30 pulses. And then you could do like 3 sets of that on one side and then flip to the other side. So obviously, I just worked out both my left glute max and my left glute med, so I would want to flip around, which I'm not going to do right now, but I'd be facing the wall and I'd do my right leg. So you're working the side that's on top. Sometimes it feels really great on one side, not so great on the other. It is okay to do only one side. A lot of times, if it's not feeling good, I would skip it on that side. So it might be that one of those particular exercises feels great on the left, not on the right, and maybe the other one is the opposite. I would always choose the ones that work best for you and are not causing you any pain. So thanks for watching. Please, if anything in this video was helpful, give it a thumbs up and subscribe to our channel for more content, and we will see you next week.